Hi, this is part 2 of the Clarity X test results. So I think the most interesting thing is the high sensitivity to the Coumadin because, like I said, my mother used to take Coumadin for her heart condition. And now I'm skipping to page 30 where they talk about I have a genetic variation in CYP450 enzymes, which I may have looked that up. We're going to get to that later. Which is not expected to affect Cymbalta. So I guess I'm okay with Cymbalta. Although I've tried Cymbalta and I just didn't feel like it worked for me. That's my son in the background. So then it goes through all these pages, and most of this is like drugs that you're okay with, but it goes like through the alphabet pretty much, like A to Z. And then it gives you like, I guess, the professional name and the name through like, popular name, like Fluoxetine. What is it called? There's a different name that they use for what we call Prozac. It's telling me that Zoloft is okay, but I never really cared about taking Zoloft. It was just made me eat too much. So there you go, all the way to a medication that starts with Z. So they really do take you through the alphabet. And then it's the crazy part, the part that gets you all about your genes and all the breakdown. I'm gonna do my best to read this. So certain things I found out: multi-drug resistant protein, which is ABCB1 gene. Dopamine pathways are altered, the DRD2 function. Metabolizing neurotransmitters and dopamines is I have the low compt-activity. So I'm looking at my notes here, and I wrote down hypodopaminergic functioning, condition that may contribute to a number of behavioral abnormalities: ADHD, bipolar disorder, learning and memory. So that's a big one. Decreased dopamine release in prefrontal cortex when stimulated electrically. Impaired dopamine storage in bestials. Interesting. This is probably why I'm doing more magnesium these days. It talks about something called the reward deficiency syndrome, which could be something that I have. People need external stimulation to achieve positive feelings, satisfaction, pleasure. Sounds like me. So on the rest of this list, I have a gene called CYP2D6, which has to do with the liver. And that looks like that's okay. CYP2C19 is also normal. I'm not sure which one that is. I had a hard time looking up all of these genes. SLC01B1 gene, which also seems fine. I'm not sure which one that is. And CYP1A2. This one says normal metabolism, possibly inducibility. Don't know what that means. But you can look up some of these, and some of these will say something and some won't. Like when I looked up gene, actually some of this was from like talking to the lady at Clarity X as well. So I have here gene ABCB1, heterozygosis variant, can affect function of the P glycoprotein and the transport of substances across the blood-brain barrier. That's a big one I'm trying to figure out. I mean, the whole ADHD thing with that, it's like there's definitely like pathways that need work. Genotype 3435TC. This variant can alter the function of PGP and are risk factors for some neurodegenerative diseases. Interesting. Variant that doesn't change the amino acid, but may reduce mRNA expression and protein stability. That's twice I've heard protein mentioned. can alter concentrations of various antidepressants in the brain. Encoded P-glycoprotein encoded by gene ABCB1 regulates depression or depressive disorders, the active transport of some antidepressants across the blood-brain barrier. So there's something in me that's causing issues for things. So like maybe there's a hard time with certain things processing. ABCB1, SNP, single nucleotide polymorphisms affect the expression and or function of the P glycoprotein in vitro. I don't know, saying something happens in pregnancy maybe. A heterozygote variant in an organism that has two different alleles for a specific gene or genomic marker inherited from each parent. So they were saying like there were certain things that were inherited by both parents. There were certain things that were inherited by one parent. And again, trying to be a scientist is not easy. But I was like doing a lot of vocab. So heterozygotes, having inherited different versions, alleles of a genomic marker from each parent. When a person is heterozygous for a genomic marker has two different versions of that marker. I know, it's messy notes, what can I say? And what did I write here? I wrote if it's dominant in... So it's saying if it's something that's dominant, it only needs one mutated copy to result in disease, dominant disease or dominant disorder. Okay. Is it one normal and one mutated or two different mutated? That's a good question. And I have here DRD2, the altered DR2 function for the dopamine. And I wrote here nicotine dependency, Parkinson's, bipolar disorder, obesity, Alzheimer's, smoking cessation. I'm thinking these are things that like people who have issues with dopamine can fall into these categories. Renders the dopaminergic system inefficient and reward substance abuse that increases dopamine levels. Well, I don't do substance abuse, but I do have family that have been into like gambling and different things and stuff. And there's definitely like a whole, I need this to feel good, which is interesting. Then one of the genes says that CYP3A5 has to do with poor drug metabolizing. So I'm not sure if I have a hard time metabolizing drugs and I metabolize things at a lower percentage, and that maybe there's sometimes when I need to go at a lower dose and sometimes when I feel like sometimes I need to go at a lower dose for certain medications because it affects me strongly, and yet they're also telling me here that I don't process it as well. So that's very confusing. So the gene is GLP1R. It's the one that ensures the B cell insulin stores are replenished to prevent exhaustion during secretion by promoting insulin gene I apologize, I'm trying. Transcribing or whatever, mRNA stability and biosynthesis also increases B cell mass by promoting proliferation and neogenesis while inhibiting. I'm not sure what this means. It seems like I just have an issue with processing insulin or preventing exhaustion. I'll have to look more into that. Sorry, more question marks. Well, I do have people in my family that have diabetes, so it's saying something about diabetes, so that could be something about it. Then the PNPLA5, LA5, that's a protein coding gene that encodes a lapsus lipid homeostasis triglyceride required for, I'm just gonna skip that word, required for optimal